Hello, I'm Laura Wright, and I'm responding to Brittany Wiseman's post in regard to infective endocarditis. I frequently care for patients with infective carditis, and it's increasingly complex because these patients are often associated with a history of polysubstance IV drug abuse, and often come with a host of other health concerns like hepatitis C infection. I frequently see cellulitis and abscesses. And it's difficult because these patients not only need physical treatment, but they also need behavioral health counseling as well, associated with their often traumatic histories that eventually lead to drug abuse or alcohol abuse. In our practice, treatment often includes getting long-term access, such as PICC placement, because our patients will frequently need to stay in the hospital and complete at least 6 weeks of IV antibiotics. It's difficult during this process of IV antibiotics over the course of 6 weeks because you're concerned about the patient's rehabilitation and their ability to stay sober while they're fighting the infection with the IV antibiotics. And that's one of the reasons that it surprises me, is that these patients are often battling what can be a life-threatening infection, but often really don't want to comply with the IV regimen. They'll often ask to be unhooked or not complete the IV antibiotics, even though they're told that this could potentially have life-threatening difficulties associated with it. So another thing that surprises me about the condition is that they can become so sick and become so symptomatic and feel bad, but yet still often won't verbalize the desire to quit the drug abuse that led to the situation, and often aren't interested in rehab. It also surprises me that there are usually friends and often significant others that are around during the time the patient is so sick when they're battling infective endocarditis. And a lot of times the support system is just not there. They don't seem very concerned about the infection that their loved one is battling, but seem a little bit more concerned with still living that lifestyle and promoting the lifestyle that ultimately led the patient to getting endocarditis. Overall, infective endocarditis is an increasingly common condition that I see in my day-to-day nursing, and it's incredibly complex because of the amount of behavioral and physical components in this patient population. So I just think it's important that we strive to treat the addiction just as much as we strive to treat the physical infective components in an attempt to not only get them better, but to improve their lifestyles overall and prevent recurrent stays in the hospital.